I'm here with House Majority Leader Bryan Cutler. Thank you for being with us today.
Thank you for having me.
The House just passed a measure that aims to create a pandemic response task force. What would this task force do?
Well, the goal of the task force is really to start taking a look out ahead and help set the course and plan for how we will eventually exit the current quarantine process and hopefully get the economy restarted. I think everybody agrees that we have to stay on the front side, immediately focus on the quarantine efforts and the efforts to stay physically apart from one another, because that helps to slow the spread of the virus. However, at the same time, we also need to be looking forward, understanding what it's going to take in terms of both testing capacity, hospital and healthcare resources, as well as budget impacts and programs as we prepare for next year so that we can meet the needs for everyone here in the Commonwealth. And along those lines, this task force made up of members from all three branches of government, both the legislature and the executive, but also the judiciary, and then make sure that those voices have a forum where we can share ideas on how we've been impacted or our constituencies have been impacted by what has already occurred, and most importantly, how we plan going forward. For example, the quarantine and the closure aspects certainly have been personally very difficult for some individuals. And that may have job implications. It may have mental health implications. It could have a whole host of things that could be impacted by the decision to quarantine. So we need to make sure that in the case of mental health, that the appropriate resources are there in terms of finances and funding the different social programs, which we expect will have a higher demand as we come out of this. But also we need to understand that the quarantine also impacted the court systems, because many of their programs and much of their funding is funded through court filing fees. So as they have also been closed, they have lost those. They have mental health courts. And I just think that the task force provides that format where all three branches of government can correspond and plan on behalf of the citizens of the Commonwealth.
What measures are currently in place to help businesses that have been affected by the lockdown?
Well, in terms of the businesses as well as the individuals who may have lost their jobs, much of that we covered in the prior week of session. We passed reforms to our unemployment compensation bill, which was House Bill 68, and waived the waiting requirement that typically was in place, and we made it consistent with the federal requirements. And I know that the federal government is currently working on the process by which people who were previously unable to collect unemployment compensation may now be able to do so. We're still waiting for all those finalized details from the federal government. We hope to have them soon. We've discussed that through our labor committee chairs, and we're looking forward to how that will work. But many of those resources are available. I'd encourage individuals who would normally qualify for unemployment. They're encouraged to file and go through the process. I know that they are very busy now. In my local district office, that has been the lion's share of the recent calls that we have received, and we're trying to help constituents navigate that process. Obviously, there was a large increase in terms of the number of people who are currently unemployed, as well as the impact, and then you layer on that the added confusion regarding those individuals who previously were ineligible because they were self-employed. So all of those components are currently being worked through by the governor and the Department of Labor, and we'll do what we can to connect them with those resources as we move forward.
Well, you represent a district that is mostly in Lancaster. How has your home district been impacted by the virus?
Well, we've seen a lot of different things happen. Lancaster County is a very diverse county. Obviously, we have Lancaster City right in the middle, and we have two hospitals in the city area. And in that case, they obviously have been impacted on the healthcare front. My wife's a nurse, works at one of them. So they have been busy gearing up and preparing for the expected surge of patients. Once you get outside the city and many of the surrounding suburbs where there's a lot of professional businesses, engineering, accounting, law firms, things like that, they've all been impacted in different ways as well. But when you get out into where we live in the country, we have a lot of farms who typically by the nature of their work already were socially distanced. They work on their home farm and they work there. So they've been impacted because of the decreased demand for food products, particularly dairy farmers, as well as eggs, because the restaurants being closed and the schools being closed. We've seen on the news, unfortunately, stories of farmers having to dump their milk. And while that's reimbursable through the federal program, it really is unfortunately very wasteful for trying to get food to those who are still hungry. And unfortunately, I'm afraid we may need more food resources as we go forward and the longer that this takes. So by and large, I think the people of the Commonwealth are very committed to winning and doing what is necessary against the virus. But I also think that they deserve to have transparency and have a plan when it comes to how we will exit from quarantine. Because I think that we need to understand something regarding the current quarantine and what it will look like as we head out. For those individuals who successfully quarantined in place and did not or were not exposed to the virus, it is a potential that when folks come back out, that the virus could have another increase, or it could in fact become seasonal like other kinds of flus, or historically it could come back in the fall like the 1918 flu pandemic. The reason I raise those is not to scare people, but so that we can understand that in the short term, the quarantine served its purpose. And if you were not exposed to the virus previously, you still need to be very careful, be mindful, wash your hands, make sure that you practice many of the habits that we're all employing right now in terms of social distancing and hand sanitizer. So I think that individuals need to understand that if there is an increase as we start to return to normal, that is not a failure of the original quarantine. And I think that we need to help explain that so people understand what to expect in the future, because I think the biggest possible problem that could come from that would people would simply assume the quarantine did not work, and therefore they would not listen again in the future if such a measure was ever needed again. So I think we need to be clear and communicate our plan. The task force would give us the platform to do that, and I think that Pennsylvania as a whole is very committed to doing what is necessary.
You mentioned the word transparency. You recently offered a resolution to amend House rules to make expense reports more public. Why was this necessary, especially right now?
Well, that's something that I had promised prior to all of this starting, to be very honest, and I follow through on the items that I say that I will work on. There was a series of news stories regarding expense reports, and once we learned of it, we made the change and released the information that was asked. I understand there are legitimate purposes for legislative privilege, and I understand the separation of powers, but I'm also a big believer in transparency. For example, I have posted my expenses online since my very first term. That's something that I've always done for my legislative expenses because I believe as taxpayers we deserve to see how our money is being spent. In this case, the information is no different, and I thought that the easiest way to do it would be to offer the rule. That was something I put in the works weeks ago, and while we had a lull here between session days, I went ahead and introduced it. I think that it was right to do then, and it's still right to do when we come back.
The statewide lockdown forced all non-essential businesses to close, including our state-owned liquor stores. Has this pandemic renewed a push for liquor privatization?
Well, I think that what you need to do is start with what do customers or citizens expect. I can tell you that many individuals have asked why the stores are closed. I understand why they are closed, and I understand that their online program has not been as successful as perhaps they had or the customers had hoped for. So I do think that may spark continued interest in the privatization or the increased availability for points of sale for the liquor system. So I do think that debate will continue even outside of the current pandemic. But I think that a lot of folks, in a lot of ways, it really comes down to what do they expect. And in this case, they expect a system that works, and the current system isn't.
How will this pandemic affect plans for next year's budget?
Well, I think that we're going to have several issues, not just in this year's budget as we wind it up, but also next year, as you point out in the question, because revenues will continue to fall as we go forward. It's one of the reasons why we passed the measure from the House that's currently in the Senate to recommend refinancing all of our state debt. I think that we need to do everything in our power to save as much money as possible so that we have the money that we will need to fund the social programs that we know will have increased demand as this continues to play out. So there will certainly be some revenue impacts on the state budget, but I think the bigger issue will be the personal impacts. I mentioned at the beginning of the interview the impacts on mental health. And that's one of the reasons actually why I don't like the term social distancing, because I think right now is really why we need to be even more social. We need to let our friends and our neighbors and our family know that we are there in society to help them. And I prefer the term physical distancing, but for whatever reason, social distancing was the term that caught on. But I think that as a whole, and as friends and neighbors, we need to be available for each other. We need to help people, and we need to do what is necessary to support them. And so I personally usually use the term physical distancing if I catch myself, but I'm not always sure that people understand what that means. It is something that I think that we will continue to have the human impact for some time, because there are many small businesses, unfortunately, that will not be reopening. They do not have the ability or the access to the various programs, several of which who have already run out of money in terms of even having the option of staying open. And that's very, very sad. And you've got family-owned businesses that literally have lost everything that they've worked for in their lives, and that will go well beyond the budget cycles, and really will be in our fabric for some time to come.
Do you have any idea of when certain restrictions might be able to be lifted, or maybe some more aid will be able to be given to some of these businesses or people who need help that they need?
Well, from a legislative perspective, we continue to work on a variety of different goals and ideas on how to help lessen the impact of this. In terms of specific days or that approach, it's really what I've asked the governor for several times, and really what I would envision the task force actually doing, and that is laying out a clear plan. I believe that the citizens of the Commonwealth will sacrifice, and they will sacrifice to a great extent, if they understand the plan and the common goal. But we have to communicate that common goal. And right now, it's simply stay home. That's all we've heard. Whereas if we say we're going to stay home until we see a noticeable decline in the number of new cases, and you quantify that. In order to do that, you're going to have increased availability for testing. You're going to have more rapid testing than we have currently, and I realize that many of those resources are still coming online. And then you can plan accordingly, because you'll have the resources and the format to make those kinds of informed decisions. One of the biggest concerns that's expressed as people call our office is simply the unknown. They don't know how long they could potentially be in quarantine. They don't know how long it'll be until they get back to work. And that's an unfair situation to put anybody in. And it's okay to say in a week or 2 weeks, we're going to evaluate it, and here's the criteria that we're going to use. I think that's what the task force would get us, and I think that it would also help improve the public's faith in the current system. And so we're going to keep working for that. While we don't know a day in terms of a certain date or a certain time, I think the goal is to work towards a decreasing number of new infections, an increasing number of recovering patients, and then understanding how to slowly and responsibly, and this is very important for those who want to return to work and those who can safely do so by following the CDC guidelines, you could then slowly start to open that back up on the way out. All of that can be accomplished with the task force, which is why we supported it.
And finally, working in the House, usually with a lot of people working in close proximity with each other, how has the House been able to operate and get things done while still practicing social distancing?
Great question, actually. We're one of the few legislatures in the country that continues to operate, and we've all taken slightly different approaches to this. So we very early on implemented a work group, and we came up with a rule that would allow for remote voting. And by that, I mean I could sit at my computer in my office in the district, and I could direct the clerk on how to cast my vote. We had to make a rule change for that. We were one of the first in the country to adopt it. We had several other states call and ask for it. And then we also maintain, obviously, we wear masks, and we maintain safe social distancing on the floor as well. Really, the handful of days that we've been in, it's always been about 50 people. The chamber is very big. Everybody stays fairly far apart from each other. And obviously, everybody uses a lot of sanitizing wipes and hand sanitizer, just like everybody else has really become accustomed to doing.
All right. Well, House Majority Leader Bryan Cutler, thank you so much for your time.
Thank you for having me.
We have 3 branches of government: executive, legislative, and judicial.
Voting is a civic duty. Voters are an integral part in government operations.
When I run for office, you can be my campaign manager.
Do you have a child curious about civic engagement? Support their passion with PCN Civics 101, a free online resource presented by the Pennsylvania Cable Network. Easy-to-watch videos take learners into the Capitol to see how our state government functions, meant to enhance your child's classroom studies. Go to PCNTV.com to start watching. PCN Civics 101, teaching Pennsylvania politics and policy.
I'm here with Mario Mazza, General Manager of Mazza Vineyards and Chair of the Pennsylvania Wine Marketing and Research Board. Mario, thank you for being with us today.
Thanks for having me.
So what measures are you taking at your own vineyard to keep business going?
We've been working to adapt, in a number of ways. With the guidance from the state and even at the county level, and then subsequently at the federal level, our retail operations, traditional tasting room experience, the winery obviously is just not something that could continue safely. So very early on, we moved to, contactless curbside pickup, really worked on ramping up to provide shipping orders, direct to consumer shipment options, as well. And that's really what we were focusing on in terms of adapting from the retail side of the business. We also canceled any events and things like that had been scheduled even through the end of April. We canceled those in mid-March. And we're still looking to reevaluate, where we stand as we go into May at this point, recognizing that, it might, still carry on into June. And so we're still reevaluating on a daily and weekly basis what exactly our next options are.
How has this lockdown affected Pennsylvania wine sales in general?
I really don't know from a statewide level what's really happened. Unfortunately, it's hard to say. We've got a lag in data in general to really know what that's done. I think a lot of it's just anecdotal at this point. Anecdotally, I know sales through WPs, wine expanded permits, things like grocery and convenience stores have seen an increase with the closure of PLCB, fine wine and good spirits stores. Wineries that do have an online presence or effective curbside programs, I think, are seeing some of those channels obviously grow. Whether it's fully replacing what the traditional retail sales would have been, I would say it's hard to tell. Fortunately, maybe for our industry, we're not in the peak of tourism season, so it's not quite as high to fall from with regards to those lost sales. But it's not been easy on a number of producers, and especially on wineries that rely heavily on events, music, entertainment for a component.
You mentioned online sales. How can people still get wine through, even though there's a lockdown at the moment?
Oh, I'm sorry, I lost you there.
Oh, let me start over. So you mentioned online sales. How and where can people still buy wine during this lockdown?
So, right now, the vast majority of it, I think, is being done in kind of two channels. From an online standpoint, a lot of that is dependent on the individual producer. So individual producers have, their website, and they may have an online store. Some of them may not have an online store, but they probably are accepting phone orders, I would imagine. The other option for wine in Pennsylvania, and it's only relatively recent, the past few years, thanks to Act 39, is through grocery and convenience stores. And those seem to be the two channels, at least, that we're seeing. And then also, in others that we've spoken with are seeing as their primary, sales sources right now.
Okay. And how has coronavirus affected the wine industry's actual production of wine? Have people been able to still produce wine or make it?
Yes, I think we're still seeing a lot of people still manage to produce and carry on operations in the cellar. Wine America, a national group of which I'm a board member as well, a national policy group based in DC, conducted an industry survey, and they're conducting another one here next week, really to try to find out from a national perspective what's happening in the industry. What early indications pointed to is most wineries were still carrying on their production operations, albeit some of them slowing down, given maybe some uncertainties with demand or need in market, but still able to carry on those manufacturing aspects. Things in the vineyards are still able to carry on. Fortunately, it's very easy to socially distance when you're working out in the vineyards. Even within our facilities, staff is spread throughout a cellar. We've implemented additional, procedures and protocols to help ensure that they're, able to, conduct their work effectively, safely, and spread out through the facility.
What resources are available to businesses, particularly in the wine industry, that have been maybe negatively affected by this lockdown?
I think that's, an ever evolving question. I can't say that I'm, an expert on that necessarily. I think, some of the stipulations available in the CARES Act that passed from the federal level definitely provide some resources. I know there was some question early on as to whether the wine industry would be eligible for things like the Paycheck Protection Program. They are, because while some may have vineyard holdings, they're not primarily agricultural businesses. They have, a retail manufacturing aspect about them as well. So I think those are some of the resources. There's been some great, information provided by the likes on a national level of Wine America. The Pennsylvania Winery Association has done a great job from very early on of providing, relevant industry information on their website, and has been a good resource in both the website and regular newsletters to the membership. And that's been helpful because as for everyone and across industries right now, it's unprecedented. It's happening at such a pace. It's really hard to make heads or tails. And every time you think I've got an understanding of it, you wake up the next morning and you realize, no, you actually don't.
Mm-hmm. And for whenever this lockdown and situation is lifted and restrictions are lifted, how long do you think it will take for businesses in the wine industry to recover in terms of sales, employees, and visitors?
I would say some of those questions overlap, but they're not all necessarily the same. And I think it maybe depends on the wineries themselves. From an industry perspective as a whole, alcohol sales are, we don't call them recession proof, but they tend to be recession resistant. So there are still sales, but they may diminish. They may change in terms of price points, categories. I think, what we're seeing, at least, again, this is very short term, a few weeks, we're seeing that sales in terms of off-premise consumption, so those wholesale channels, grocery, those are helping to offset the losses in the retail space, but they're not making up for it. And as time goes on, we're going to see more and more erosion as we go into what are typically higher sales seasons. Personally, from our perspective, we're looking at this as there's going to be a transition period, and it's not going to be a few days or a few weeks. It's going to be some time. We don't expect suddenly June 1st, our operations go to normal, we fill the tasting room, and it's back to what it was before. So how do we do that as our own winery? How do we do that as an industry to make sure that we protect our staff, protect our consumers, and ensure a safe place? I'm not sure. I think it's going to take some time, and I think it'd be interesting to see what the industry sentiment as a whole. But I think it's going to be a matter of months, and maybe could be later this year that we start to approach it still what I would say is a new normal. I don't think that even this fall, our tasting rooms are going to operate in the same way that they did last fall. I think that's probably a more realistic point of view that we all need to take and determine how do we move forward in a safe and effective way. A lot can happen between now and then, so it's really hard to say.
Well, as you mentioned, tourism and having visitors is a really big part of bringing business to vineyards. Do you think that people can expect to be able to visit their vineyards when the season comes, business as usual, or do you think that will have to come a little bit later?
I'm hoping that there's going to be, I think first and foremost, we're going to have to follow the lead of, what recommendations are out there, whether it's by, the CDC, whether it's by the state government, even local municipalities. And even then, I think we're going to want to proceed cautiously. As a member of the local tourism promotion agency, Vicinity here, there's been discussion of, what does a planning effort look like on behalf of all of tourism affected businesses in terms of how to emerge from this and how to do it effectively, safely. And so I think that's something that those conversations are happening at an industry level from a tourism perspective, not just the vineyard and winery perspective. And we're involved in some of those conversations really early phases right now to even determine that. I think first and foremost, the priority needs to be on adhering to the best guidance, making sure to adopt social distancing and making sure that we're doing those things to get this under control before we really rush to try to get back out there. At least that's my personal sentiment. We don't want to see businesses fail because of this, but also we don't want to see, unnecessary, death and other, adverse impacts from it as well. So it's a difficult position. And I don't know. I think we're monitoring it on a weekly basis is what I can say that, we're hopeful that we can, kind of rebound later this year, but time's going to tell what that actually looks like.
Well, you're also the chair of the PA Wine Marketing and Research Board. What does that board do?
So that board is actually originally formed over 15 years ago within the Department of Agriculture as an ACMA board or a commodities board. So we have industry self-assessed fees for every gallon of wine produced that our winery producers in Pennsylvania contribute to. And we use those monies to invest in marketing and research and have for well over 15 years. It was formed under the Ridge administration. More recently, that board was also added to with regards to 4 legislative appointees and then given the responsibility of recommending projects, both marketing and research, to the Pennsylvania Liquor Control Board for funds that were allocated to our industry, also to the beer industry. They have a separate board, but as part of Act 39. So again, we continue to make recommendations and evaluate programs that are for the benefit of Pennsylvania wine and grape industry with regards to marketing and research.
Well, you alluded to it a little bit earlier, but just looking generally into the future for the wine industry in Pennsylvania, do you think that they will be able to continue their growth after the impacts of this virus, or do you think that some plans will need to change to kind of get back on track to continue to grow?
I think it probably may be a question of term. I think maybe, there's going to be some stall or stagnation for a little bit, but I think the industry is still poised to continue that growth in the medium and long term. And I really think that because there's a lot of, dynamic individuals in this industry, not only in Pennsylvania, but throughout the country. And the amount of adaptation we're seeing, and I'd say it's not just in the wine industry, a lot of industries are having to learn to adapt to this. We're very much of the mindset that those things are going to make us stronger as businesses when we come out the other side. Having things like, enhanced wine club offerings, virtual tastings, and other opportunities that don't go away after this is done, but they are then hopefully an enhancement to what were previous business models as well. And so now there's a wider range of offerings. So, I tend to be the optimist and looking at it as a glass half full, and we're taking this as an opportunity to maybe shore up some areas that we hadn't focused on, but build those out in a way that they have some relevancy beyond just this crisis, from a business standpoint, to ensure that we're able to weather the storm, but come out the other side and come out the other side hopefully stronger. And I say that not only from a personal perspective, but I think very much from an industry perspective. I think there's a lot of great folks in this industry that are probably working at that same mentality. They're not throwing up their hands and saying, oh well, I guess I'm going to go out of business and that's all. These people are, when you work in agriculture and you're at the mercy of Mother Nature, you've got to have kind of that adaptive and fighting mentality, and the folks in our industry do. So I think the Pennsylvania wine industry is going to reemerge and continue to grow after this is all done.
All right, Mario Mazza of Mazza Vineyards and Chair of PA Wine Marketing and Research Board, thank you for your time.
Thank you very much for having me. Take care. Be safe.
PCN is committed to providing the people of Pennsylvania with the most up-to-the-minute information about coronavirus. Daily special programming with civic, business, and government leaders and how COVID-19 is affecting the community. Airing weekdays at noon and 8 p.m. Live special coverage of the Governor and the Secretary of Health, as well as programming designed to inform and assist everyone impacted. Go to pcntv.com for the latest information.
I'm here with Christopher Borick. He's a professor of political science at Muhlenberg College and also director of Muhlenberg College's Institute of Public Opinion. Thank you for being with us today.
Oh, it's my pleasure.
So Muhlenberg College recently released its coronavirus survey. What did you find about people's concerns about coronavirus in those first couple of weeks of March?
Yeah, it was interesting. We were doing our annual quality of health survey in Pennsylvania. We do every year this survey, and it just so happened that this year we were in the field as the coronavirus outbreak really started to take hold. And we found that even at that time, this was in those first couple of weeks, that a large percentage of Pennsylvanians were concerned about the matter. That concern level was increasing over the 2 weeks that we were in the field. And that at that time, we saw that a slight plurality of Pennsylvanians were satisfied with the level of effort that the federal government was putting in. So that's, a few weeks behind where we are now. But at the early stages of this, Pennsylvanians both were exhibiting concern and, on the whole, satisfied with the policy efforts that were being put forth at the national government to deal with the crisis.
And you mentioned that you noticed that those findings evolved as the intensity of the virus spread. Would you maybe inference that trend would continue now?
Yeah. Now, while we weren't in the field as over the last few weeks, as this is really, taken off into the stages that we're all experiencing, I would only imagine the concern levels would have risen, the saliency among the public, and it'd be interesting to look at the public responses. What I have seen in the national polls, I haven't seen any in Pennsylvania since we've been out in terms of coronavirus reactions, but in the national polls, the general positive reaction to the policy efforts has diminished. And some of the most recent polls this week at the national level, again, not only in Pennsylvania, demonstrate that there is increasing dissatisfaction with some of the aspects of federal efforts and national policy to deal with the issue.
And how do Pennsylvanians' opinions on the federal government's response to coronavirus compare to other states or those national polls?
Yeah, well, when we were in the field, and even that period directly after kind of the late parts of March, our numbers were in line with a lot of the national and state level surveys that I saw in terms of most Pennsylvanians having similar views about the federal reaction as you were seeing in other states and at the national level, polls at the national level. There was a general sense, I think, of support for the efforts that were coming out of Washington to start to deal with the COVID-19 outbreak. Again, and this is more from the national polls that I've been looking at rather than Pennsylvania specific, but over the last week and a half, you've started to see some of the erosion of that original support. And that does happen sometimes in crises where there's kind of a rallying effect right after a crisis hits and government intervenes. And then as it goes on, there's more critiques and more critical reactions to it.
Did you notice that any certain demographics were more concerned than others?
Yeah, this is fascinating and also troubling. I teach public health policy at Muhlenberg, and you think in terms of health crisis, you might see some of the divisions that are part of society not take place in the public health world. But at least in the early stages, when we were looking at this in Pennsylvania, what we saw was that people were viewing the concern for this outbreak through a partisan lens. In other words, Democrats expressed much greater concern with COVID-19 than the Republican counterparts in the Commonwealth of Pennsylvania, that there was a significant difference in concern levels. We also saw concern levels differ across things like age, which probably isn't surprising given that the epidemiological studies have shown that this is targeting much more individuals that are older in Pennsylvania, and younger individuals aren't as impacted. They might be as likely to contract, but not as likely to feel some of those impacts. So we did see a lot of demographic differences, and unfortunately, at least I think unfortunately, some of the same partisan divides that we see so often in Pennsylvania and beyond taking hold within how we're perceiving a public health crisis like COVID-19.
Well, you also mentioned that Muhlenberg College also released its annual public health survey. What did that survey find about people's general feelings about healthcare in Pennsylvania?
Yeah, it's really, we do this every year. We've done it since, I think, 2013, and we look at general perceptions about health, how general health is, healthcare systems, reviews of government officials, and concern levels for issues like the opioid epidemic, policy changes like marijuana legalization. We looked at sports injuries this year. We looked at immunizations, perceptions of immunizations in general. So it's a really full thing. It's available on our website. But one thing that I did notice from last year was just on general perceptions of health. We saw a increase, or healthcare in Pennsylvania, we saw an increase, statistically significant increase in the number of Pennsylvanians that said healthcare in the state was poor. Now, this, of course, coincided with where we were in the field this year in the middle of a public health crisis. So I don't know if those are long-standing feelings or affected by the outbreak, but certainly it was something noticeable in our results compared to our 2019 survey.
And people's general feelings towards healthcare in Pennsylvania, has that improved or decreased since 2019?
Yeah, that was where we saw some of the decrease. Majority still said they thought healthcare in the state was excellent or good, had positive ratings, but the percentage that said it was poor had a double-digit increase over the last year. It was still a smaller portion in the teens of Pennsylvanians that felt that, but it was clearly noticeable compared to 2019. Those are some of the trends. It's interesting when you do this survey every year and you ask questions periodically or every year some of the changes. We've seen that with marijuana legalization, for example, in Pennsylvania since almost every year. I think every year we've seen an increase in the percentage of Pennsylvanians that support legalization of marijuana. We've seen it in areas like heroin abuse and the numbers of Pennsylvanians that have known somebody that experienced opioid or heroin abuse. We've seen those numbers go up. And so it's these trend lines that are very fascinating to me to look at. And I think they capture where the state is evolving on a number of health issues.
Has your team had to change its approach to conducting these surveys in light of having to social distance and just not being able to be in close contact with people?
Yeah, it's really had an effect on our operations and other operations, especially when you have an active lab, for example, doing telephone calls on campus. Obviously, in our case, we've shut down the campus. We've gone to remote learning. We had finished the surveying before we made those changes at Muhlenberg, so we kind of had our poll done as the change was happening in our community. But a lot of other research organizations that have labs on campus have been forced to shut those down. Luckily for us, not in so much in our case, but the field as a whole, you can do some remote interviewing. People can do it from their homes, just like we're talking via Zoom right now. They have technology where people could do their interviewing and it all goes to a common server. And so you can continue to do telephone interviewing during this period if you have the right technology. So a lot of firms are still doing their polling. We're looking at, for us, what options might be available for us to do our next poll, since our traditional means is at this point not available to us.
You mentioned that your public health survey encompassed lots of health issues that affect Pennsylvanians. Do you think that after experiencing this pandemic, people will be more concerned about issues that have been affecting Pennsylvanians all along?
What a great question. I just finished up my public health policy class with my students via Zoom, just like we're doing right now. So we had the same conversation today. What are the lasting impacts of this? I can only imagine on infectious disease that we're going to be much more attentive to it. We are going to pay attention to things like surveillance, preparedness, that we won't be caught off guard in the way that it seems we have been caught off guard to a substantial degree with the COVID-19 outbreak. What's fascinating to me, and I was talking with my students today, is what kind of impact does this have on our perceptions of other public health issues, chronic illnesses? You know, the amount of Americans that die every year prematurely from heart disease, cancer, other factors, including substance abuse, are significant. Do we start looking at those differently after we've had to come face to face with an infectious disease outbreak? That's less certain to me. I'm not sure what kind of impact that will have. My optimistic side for us being someone that teaches public health policy is that we'll start viewing public health in a much more serious way, not only with infectious disease, but also in chronic disease, environmental health threats, which we know numerically and from epidemiological studies are incredibly pervasive in our society. So that's perhaps a positive would come out, that we're more attentive to those things.
Presidential candidate Bernie Sanders recently suspended his presidential campaign. He was a big proponent for Medicare for all. Do you think that healthcare will still be a major topic in this year's election?
Yeah, it will be a dominant topic. It was already a top tier a topic, an issue when we've polled. I could only imagine its importance is magnified by the healthcare crisis we're dealing with. Of course, economic concerns are going to rise. We've actually seen healthcare over the last few years rise even above economic concerns. The economy and jobs were in great condition, and that's, of course, changed with this crisis. So those things will probably rise, but I think healthcare will be right there. We saw in our poll, we asked questions asking individuals support for a number of healthcare reforms. Bernie Sanders' support for Medicare for all was fairly divided in terms of the reaction of Pennsylvanians. It's almost a 50-50 split of Pennsylvanians that support that option and oppose. The one option that we tested that has incredible support is the Medicare public option, the buy-in option, where individuals can buy Medicare insurance on the market, like they could buy a private insurance option. Overwhelming, 3 out of 4 Pennsylvanians support that policy option. That's the one that's been supported by the presumptive Democratic nominee, Joe Biden. And it seems to be a sweet spot, if you will, among public options that are tested for the public right now.
Well, Pennsylvania's primary due to coronavirus has been pushed back to June 2nd, already being a late primary among other states. Will Pennsylvania still matter in this year's election?
Well, sadly, it's an interesting story, and historically we don't matter because we're late. It seemed as this race was going on and it was becoming competitive between Joe Biden and Bernie Sanders that for once we might matter when it was going to be held in April. It probably wouldn't have mattered even if it was now because of Senator Sanders' decision, but certainly the suspense is off by the time it comes to June. So what's interesting in that perspective is usually if that was a competitive race, it might draw people in to vote in that campaign. Without that draw, I wonder, and also in with some degree of the healthcare situation still carrying on, what kind of effect it will have on turnout. Lots of primary races at congressional levels, at local levels, at state legislative district levels. So we have a number of primary races in the state. I wonder, on the Democratic side, what impact that might have on turnout. It shouldn't have a big impact within Republican primaries in the state, but I'm very fascinated to see just what kind of turnout we might see in June, given maybe the top tier ballot being taken off the table, and of course the potential to have some continuing concern about healthcare or health situations with COVID-19.
Well, Christopher Borick, professor of political science at Muhlenberg College, thank you for your time.
Thank you so much for having me on. Be safe.
During the uncertain times brought on by the coronavirus outbreak, PCN remains committed to the needs of Pennsylvania and its people. PCN provides free daily coronavirus updates from Governor Wolf and the Department of Health Secretary Dr. Levine, live, on air, and streaming on the app and online. These updates will be available to watch in their entirety on demand for free by downloading the PCN app or at pcntv.com. PCN, committed to keeping Pennsylvania informed.
Reverend Robert Collier is president of the Black Clergy of Philadelphia and Vicinity. Reverend Collier, thank you very much for joining us.
Thank you for having us.
You had an event last week where you were calling for inmates to be released. Can you tell us about that event and what it was that you were asking for?
Yes, we had an event with the director of the faith-based and interfaith affairs of the Mayor's Office of Public Engagement. We had power movement. We had clergy come together as well as elected officials. And what we're asking is for the humane release of those prisoners, those inmates who are eligible to be released, who have not been released. We want them released because of this pandemic, this coronavirus epidemic. And we believe that there's over 4,000 inmates in the county system, and it should only be around 2,000. So therefore, there's no way for the inmates to practice social distancing. There's no way they can really be safe in an environment like that. And since there are those who can be released, we're asking for them to be released so that this coronavirus does not spread, particularly in the penal system, because what this does is it gives them some of them a death sentence, and we want to avoid that.
So, what kind of offenders are we talking about here? What level of offender is it that you were saying should be let out?
We're talking about those persons who have already served their maximum or minimum sentence. We're talking about folk who are eligible for parole. We're talking about there are quite a few inmates who are there because they just couldn't post bail. And some of that bail is low enough for us to do some kind of creative financing to get that bail paid so that they can be released and come home.
And what was the reaction that you got?
Our reaction was, among us, we're very adamant. We haven't received any information from the mayor or the governor, but the DA, Larry Krasner, has been on these calls with us, and he's in favor of letting those go who are eligible to go, so that we can prevent the spread of this virus within the incarcerated population.
And have you heard anything statewide for the state prison system?
We haven't heard anything, but we understand that there have been a few people released, but it's not nearly the number that we think should be released. And it does not really speak to the fact that the jails are overcrowded. And we want to relieve that overcrowdedness, because now it's lethal to the inmates and not only to them, but to the lawyers, to the prison, the guards and those who work there, the health officials. it's really hazardous for everybody.
Yeah, the mayor's office did release some numbers yesterday in their briefing. They said that the population has gone down for Philadelphia County prisons. They said it was 4,800 and now it's around 4,200. But you say that number should continue to drop.
Yes, because we feel that there should be one inmate per cell instead of two. Because of the proximity of the closest, it's hard. You can't practice social distancing, and they're at risk for contracting and spreading this coronavirus. So we appreciate that the numbers have decreased, but they have not decreased to the area that we want them. It's not ideal yet.
And Mayor Kenney did say there's really nothing he can do. He said it's on the courts. Have you heard anything from the court system?
No, what we're trying to do, we're trying to get some influence. We're trying to influence the courts. We felt that the mayor could influence some of the president judges to react and to respond. We believe that the president judges can call in the other judges so that these cases can be heard. That would eliminate a lot of the overcrowdedness, and this is what we're looking to happen.
Are the courts functioning behind the scenes? I know they're not open to the public, but are they working?
Yeah, they're working as best they can. Like the public defenders, they're working, but they're using the technology that we're using basically because they can't be in close proximity to one another. So they're functioning, but not full. They're not fully operative and operational.
Now, Reverend Collier, it is Easter week. Easter's coming up, and you are the pastor of Galilee Baptist Church. Yeah. What would you say to those who want to celebrate Easter, but it's during a quarantine?
We want folks to understand that the church is not the edifice; it's not the building. The people are the church. When in the Christian tradition, churches started out in home. They were house churches. So we believe that we can go back to that same model. Folk in their own homes can set up their own church, and the leadership of the church will communicate with them through Zoom, go to meetings, and use technology, live streaming. But for the safety of our people, they need to stay home, because the only way that we know to stop the spread of this pandemic virus is to stay home. And so it doesn't make sense to not stay home. So stay home, and you can still worship your God. You can still serve your God right where you are. And this is what we are advocating. This is what we're pleading with our folk, to stay home and have Easter service in your home, and let your faith community leaders guide you through the technology that's available to us.
And how have you been managing leading your flock through all of this?
It's been difficult. This is the first time we've been involved with anything like that's occurring. So we've had to make some changes. We had to make some adjustments, but we're holding on. We are encouraging our folk to be in contact one with another, first of all. And then I'm in contact as much as possible. I've been calling as many members of the church as I can to see how they've been doing, to check on their condition, and to encourage them to stay home. We've been doing teleconferences to talk with folk, and we do robocalls, advising them to take heed and listen to what the medical profession is saying, to wear masks and gloves if you're going out, and to wash your hands and those kinds of things. But main thing is that if you have to go out, do what you got to do, and come back and stay in the house, so that until we get a handle on this epidemic.
Well, Reverend Collier, I think we can end it right there. Thank you very much for joining us.
Thank you so much.